Hello, today we're going to talk about bipolar disorder. Bipolar disorder is a debilitating disease. Most people with bipolar end up dying 15 years younger than the general population. It is believed to be caused by genetic or environmental factors. So there are two types of bipolar. This one is bipolar 1, which is also called mania, and we also have bipolar 2, which is also known as bipolar depression. So what are the symptoms that we usually look into? People with bipolar go between highs and low mood. With bipolar 1, which is the manic phase, symptom that we're going to talk about, they usually last about 7 days or more. So it's not something that you get 1 day or 2 hours and so forth. So the symptoms have to be there for at least 7 days or more. The first one is distractibility. So most people have issues with sitting still or completing a task. These symptoms, if you know about ADHD, you know is kind of similar. So you have to do a complete workout. At least all these symptoms, the 6 symptoms that we're going to talk about, you need to have at least 3, and they should last for at least 7 days or more to be diagnosed. The second one is impulsivity, which is also found in people with ADHD. So people who are into a manic phase, they are going to do things that are unusual, make unusual purchase. You know, they can go out there and buy 2 to 3 cars. They can also go disappear for 7 days and go and book a VIP room, stay in the hotel where they'll be involved into prostitution, spending more money that they don't have. And most of the time it could be somebody that you know they should be at work or school, but all of a sudden you'll be talking to them and they'll tell you, oh, I'm in Paris, or I'm in Florida, and you know they're supposed to be at work. So those are the symptoms that usually people track to figure out how they can help their loved ones. Grandiosity. Most of these people, when they are into manic phase, they may think they are like Jesus or God or the president, and they can even run a campaign and stuff like that. And one day I had a patient who thought they were dating the Chinese emperor daughter, and they were convinced about it. Fourth symptoms is flight of ideas. When you talk to somebody in manic phase, they have that precious speech. They can talk for 5 minutes, but during those 5 minutes, you'll be able to interrupt them. And also you can hear at least 100 ideas. So it will make sense at the end of what they are saying. The fifth sign is agitation or irritability. Sign is insomnia. A lot of people in Hollywood that have been able to come out and tell us exactly how they feel. They'll be up for 3, 7 or more days, and they are still energetic. You know, after 1 or 2 days, you're not sleeping, you'll be tired. But for them, they are so energetic. They are able to do a lot of projects. They can clean up the whole house and everything will look neat. And they're up for 7 days before you make a final diagnosis. Making sure there's no medical issues. It could be thyroid issues. It could be traumatic brain injuries. Also, frontal lobe seizures can also manifest as mania. The thing to look at is medications. Some medication can induce mania. Steroids are known to cause mania. And we know also sometimes if somebody has bipolar, it is not recommended to start antidepressant. So the moment you start, throw them into manic episode. That's how sometimes you can help the diagnosis of bipolar. For is illicit drugs. If person is using cocaine, are they using marijuana / weed / cannabis? You know, those are the other things to look for before you make a final diagnosis. Also have to be very careful, because bipolar or manic phase can also manifest as ADHD or also as borderline personality disorder. Depression, most of the time we can see that most of the people, they have more like the hypomania, and the symptoms last for 4 days instead of 7 days that we saw in mania. For them, the symptoms will be there for at least 4 days. The difference is that they have the same symptoms, but it's on the lesser degree. So what we see mostly with people with bipolar depression is that they are too depressed. They are not motivated to do anything. They can be in their house, you know, not willingly to eat or take a shower. This is very crucial, because this is where most people tend to commit suicide.